by Professor TSUDA, who I'm sure is well known to everybody, from the University of Okayama. He will be speaking to the subject, How to Exchange Information on Scientific Evidence in a Case of Radiation Health Effects. Professor TSUDA, thank you.
どうもご紹介ありがとうございました。
Thank you very much for your introduction. My name is TSUDA from Okayama University. I believe this slide, PowerPoint presentation will be published later on. Since the time is limited today, I would be very brief in certain pages. In the website of the Ministry of Agriculture, there is a statement called the introductory text on the health risk communication. This information originally came from CDC's. This is really the introduction text on principles and practice on health risk communication. CDC actually created this, and this is the Japanese full translated version of what CDC is saying. And this is what it says in that text. Myths versus countermeasures. Myth is what is erroneous, what is believed from long term. And what are the actions? If you consider the risk, the actual actions and countermeasures that people should be taking. Well, when it comes to the Fukushima accident, such principles were not observed. Why are these principles not observed at all in this case? Up until now, we have been talking a lot about scientific evidences and knowledges that we have so far. Why are these evidences and knowledges not utilized by the Japanese government or the Fukushima prefectural government? In fact, what is happening is the complete reversal or opposite in terms of the type of countermeasures that the governments are taking. And so that's the objective of my talk today. So what is the accurate scientific evidence? Well, I have been involved in various scientific fields up until now. And up until now, you have heard many experts and professors talk about various fields, important fields. You understand that. Why is this not utilized and applied in Japan? The decision makers in Japan today, well, are in my generation in terms of age. And we really need to understand their psychological background of our generation in Japan. Unless we understand that, we cannot really discuss further, just purely from the scientific perspective. Iwata-san, in the introductory opening remark, said an important statement. He cited an important citation from the Stephen Hawkins. Well, that is exactly right. Well, you would be much smarter because you would be accumulating information. But we need to convince others, the others who are not becoming smarter because they are not learning further from scientific evidences. Now, well, I'm nor rightist nor leftist. Well, what I'm about to say here is that the Agency of Reconstruction after Fukushima quote certain people, those leftists, and I realized that, well, they consider us leftists, left-wingers. Well, if we were to ask them the question, so what is left-winger for you? What do you mean by left-winger? Well, they won't be able to answer that question. If you hear left-winger, you think that there is one notion, but that's not really the case. There are various interpretations. People who are considered to be left-wingers, they are not radical people at all. They're not radical. Those people who are considered to be left-wingers in Japan are very conservative indeed. Well, radical or conservative? Well, they are rather conservative. So there's a reversal of a normal notion, ordinary notion of what left and right means. Well, this is all about my background, so I'm going to skip over. By the way, I am originally from the Okayama, where my family actually worshipped Shintoism, and we had a Shinto shrine in my home, which is a normal thing for someone of my generation. We had the Shinto. We worshipped Shinto at the same time. We also worshipped Buddhism and also Yamabushi. So in that sense, that's quite an ordinary situation for the people of my generation in Japan. Well, in a way, by going back to the scientific evidence discussion, people talk about the left-winger and right-winger, or pro-nuclear or anti-nuclear, when we talk about the current scientific evidence post March 11th. But when we look at the nuclear power plant issue, this is only 50 or 60 years old. It's a young issue relatively. Well, leftist, rightist discussions in Japan only exist for about 70 years. Oh, French Revolution, that was only 225 years ago. But our generation actually, in a way, have an erroneous belief that this division between right and left wingers exists from much, much earlier back in the history. And this tendency of this erroneous belief is much greater in eastern Japan, in the urban areas, and also in the people, the baby boomer generation like us. But however, we have much older history of opposition in the Japanese history. If you look at the religious divisions, religious wars, the emergence of Kamakura Buddhism, there has been so many more important division in different factions and parties in the Japanese history, much bigger divisions and chasms compared to what we are discussing today about, between right-wingers and left-wingers. This seems like a minute issue compared to these historical divisions and chasms. Now, from the perspective of ancient history and Japanese history, looking at the 100 millisievert dose threshold, do you think you can accept this notion? Well, why do people think that there is a threshold? Why can't we convince them? Let's look at why we cannot convince these people. After the March 11th Fukushima accident, the Japanese government started to claim that doses under 100 millisieverts are safe because excess cancer incidence is undetectable or non-existent below 100 millisievert. This is something that the Japanese governments and institutions kept repeating. There are so many examples of their statements. But from medical point of view, this is erroneous. This is from reverse of the scientific evidence that we have. Based on LNT theory, this is erroneous. On the x-axis, do we have a sudden threshold at 100 millisievert? Well, actually, according to LNT theory, even a junior high student would understand that this is an erroneous statement regarding the threshold. 100 millisievert threshold. Well, in fact, if you look back, there were some people who were claiming this existence of threshold before 2011 as well, in sporadic manner. But suddenly, after 2011, in Japan only, we have seen this insistence on the threshold. Now, so in that way, as I explained earlier, all these Japanese institutions have started to claim post-March 11th regarding the 100 millisievert threshold. This was initially led by NIRS. And creating such chart and drawing a very thick, bold red line in the middle. They stated initially saying that excess cancer is not observed below 100 millisievert. And sometimes I still see this on the internet because this was the first version that was distributed after the accident. The first version were downloaded by each municipality in Japan, and each municipality utilized this first version on their websites. If you go to the Chiba University, their website also features this first version. And if you look at different websites owned by parliamentarians or some parties like Komeito, they still use this first version. And very secretly, without people knowing, the government has changed to a newer version. But after 1 year, that was too late because a lot of people have already downloaded the first version, utilizing their first version. And in that sense, no one noticed the change because it was secretly done.
Therefore, it has been kept. Recently, they have just started to identify the wrong information. However, there are still mistakes. Even after the revision above 100 millisievert, it's clear that the cancer mortality risk will go up as the dose goes up. It indicates that below 100 millisievert, there is no cancer risk. Now, this is the basic concept on the dose criteria issued by the Nuclear Safety Commission of Japan in 2011. Please take a look at the upper right. Sorry, the English version and Japanese version do not agree. Now it's all right. If you look at the upper right, below 100 millisievert per year, there's no risk on the health per year. It's not acceptable at all. However, this is the public information issued by the Nuclear Safety Commission. However, in October 2011, there was the amendment for correction. However, that famous Professor Nagataki said at the end of June this year, he sticks to the pre-revised version, and he made the seminar in the cabinet office. I believe Dr. Nagataki did not understand this. Senior to me, medical experts with statistical knowledge, such an expert does not exist. Especially in my generation, it's a handful, just a small fraction of people is the medical expert with the knowledge of statistics. At any rate, there's a working group report put together under the leadership of Dr. Nagasuka has this information. In addition to that, the impact of the exposure as to the age bracket, it says that it's not clear that there's no age difference. Who can describe this? Yes, after all, it's Dr. Nagataki. And then this is the brochure issued by the government of Japan on the basic risk, information on the risk of the radiation exposure. Now you see the 100 millisievert. It seems that the 100 millisievert at the international threshold. Actually, it's not. It does not follow the international standard. Rather, it's totally going opposite. Now, if you look at another global of the United Nations, had issued a report after the visit of Japan, and the global report says that the 100 millisievert advocated by the government of Japan is wrong. In addition to that, the government of Japan, as well as the Fukushima local municipalities, 100 millisievert standard is opposed by many areas. 100 millisievert can cause cancer. It's not known, or it does not cause that. Still, such an information is issued once in every 3 months. If you look at the METI information, under 20 millisievert is a basis for people or to allow people to go back to the original hometowns, because the carcinogenic risks due to the radiation doses under 100 millisievert are said to be so small. Of course, compared to 20 and 100, 20 is 1/5 of 100 millisievert. However, assumption is wrong. And therefore, as you see here, the policy to return the IDP back to their hometowns is criticized by the United Nations Human Rights Committee. Now, this is the international issue, not domestic, local issue limited to Fukushima Prefecture. However, the government of Japan has issued a public service announcement as well as the articles in the major 5 newspapers saying by using the Dr. Nakagawa of the Tokyo University as authority on this area. And by the way, there's no ground supporting that Dr. Nakagawa's argument is right. Without such a basis, this description is issued by the government of Japan. And why this situation has happened? That is just a simple misinterpretation of the description of the recommendation by ICRP 2007. If you look at the Hiroshima, Nagasaki air bomb survivors report, such as the LSS cohort report, and all ages and all the cancer types increase is around 5%, showing no statistical significance. That's all. However, the government of Japan interpreted that there is no cancer. If any, it's negligible. In addition to that, as you heard already, usually below 100 millisievert can be the threshold. No way, we cannot use that value as a threshold. However, the government of Japan has done it because regulation line is not understood at all by experts used by the government of Japan. Now, Hiroshima and Nagasaki, by the way, just for your information, air bomb survivors of Hiroshima and Nagasaki, if you forcefully use 100 millisievert as a threshold, it's at the significant level of 8%. 8%. And just because there's no statistical difference and there's no onset of cancers, they mix up these two facts as a result of misinterpretation. This is really the university level examination, because nowadays in order to go to the university, high school candidates have to know the statistics. Therefore, we can call this mistake as a high school student level. It's totally ignorant, especially for the medical experts do not know statistics at all. Zilch, nil. I can say it. It's really dismal situation. And you have to know how ignorant the medical experts are. And the paragraph of Anskier includes such a description. And again, there's a misinterpretation. If you hear Anskier or people hear Anskier or CLP, what kind of a description is located where? There's no reference at all. In addition to that, the conditions for statistical significance is follows. You have to increase the number of observations and should be big enough. Those who say such a thing, cohort of Hiroshima and Nagasaki air bomb survivors is the biggest in the world, and therefore LSS cohort cannot be surpassed by the cohort in Fukushima. They cannot imagine such a situation. As you heard in the CT scan research presented by Dr. Mashu, a data cohort is definitely bigger and is bigger. The next condition is the susceptibility or sensitivity to the radiation. We have to limit the population who are sensitive to the radiation. That means that if you focus on the fetuses, children, or adolescents, then you can easily get statistical significance. However, in order the age-by-age policy or age-based discussions or discourse has not been done at all although the age-by-age stratification is very important, if you look at the radiation-sensitive malignancies alone, if you focus on them, then you see the significant difference. If you focus, for example, leukemia, brain tumor, thyroid cancer, breast cancer, then they can easily get a significant difference statistically. Then the next condition is a significance level, 5%. For example, whether the significance level is 5%, 8%, 10%, 20%, it's up to the discretion of the researchers. And there are many papers using that discretionary significance level. And therefore, if you use 8% as a significance level, then you can easily prove the significance or significant difference. For example, in Dr. Ozasa's 2012 paper's data, it contains up until 2013. And therefore, if you use currently available data for analysis, then maybe you can prove the significant difference at the significance level of 5% because the cancer incidence rate increases. And of course, these are therefore conditions. In addition to that, you should not cut out the linear regression line by intentionally set up the threshold. And of course, there's a significant increase of 100 millisievert exposure. However, what the government of Japan uses is so-called radiation stress. And there is an intervene to Fukushima residents. For instance, as to the radiation, they have the excessive fear of radiation. And for those people, the government of Japan has conducted a study to alleviate excessive fear. What's excessive?
But excessive based on erroneous data. So that means people who have accurate knowledge are treated as part of this intervention program by Fukushima. That is happening as part of the actions taken by the Ministry of Environment. Well, in a short way, this means that persuasion is not going well. The Ministry of Environment, Fukushima prefectures, government, or expert groups within the Fukushima Medical University. Well, even for a very short span of time, every time I had opportunity to meet these people, I've been trying my best to convince them and persuade them, but it didn't work at all. That is because no one is willing to have a face-to-face meeting. And the media, as for the media, well, they would have Q&A sessions for prime minister and governments, but they're not interested in interview sessions of scientists. That is why we cannot have a proper communication that leads to the adequate conclusion. I mentioned Professor Ozasa. Well, he completely gets frozen every time he hears some opinion that is slightly different from his own opinion. He can just say, "Let me answer that question later." He doesn't say anything at all. He remains completely silent in these circumstances. About 1 year ago, in the INA conference, he was like that, and before that, in many instances, he was like that. Well, he shouldn't just remain silent. Well, I did. Well, you would think that the moderator would be urging Professor Ozasa to answer a question, but that's not the case. Moderator saying that time is up. Please end your question. We need to end the session immediately. And in that way, even the moderator is supporting the complete silence by Professor Ozasa. And this is how the academia in Japan, especially the world of doctors and medicine in Japan. When we talk about in the first place, debating openly, publicly about scientific evidences is the responsibility of doctors and scientists. But the contrary is true. Many gentlemen and ladies in the medical world in Japan seem to think that it is more elegant not to talk about and remain silent. And there are so many citations of ICRP or UNSCARE, but they never mention exact citation where their citations come from. And they tend to take actions and measures that are completely contrary of the recommendation of ICRP. And they never talk about medical evidence. And if you ask any doctors in Japan, what is medical evidence? They cannot answer that question. In that sense, a basic mistake is left unattended and without being solved. We don't even know, and we can't even receive the explanations of what is known and what is not known. Really, this is the early stage of persuasion. Talking about scientific evidences, medical knowledge. Well, we can have all these elements in front of us, and in camera or in public, we can just openly debate about this. But what is going on in Japan is that we are not even at the stage of having such open forum for discussion. A simple invitation, that's what we are trying to extend. This is not about medical evidence. This is really a more basic questions of how to persuade and convince people. And in that sense, I have been reading a lot of books. I have read Aristotle. According to Aristotle's rhetoric, there are 3 conditions that are necessary for a speaker to persuade a listener. You need logos, persuasion by proof. You need pathos, talking to the listener's emotions, and ethos, finally. The listener gets a certain impression from the speaker. These are the 3 elements. I'd like to delve into that a bit later on. However, going back in 2013, WHO's report stated that in Fukushima, there is a quantitative report issued by WHO indicating the occurrence of excess thyroid cancer, leukemia, breast cancer, and other solid cancers. But this has not been reported in Japan at all. At the time of the Fukushima accident, the patient was 1 year old, and the blue point shows the excess risk of such cancer. And this is all within the 20-kilometer radius from the Fukushima power plant at age 1. This is the excess occurrence, excess incidence. But this is not even known in Japan. We are still talking about 100 millisievert. Well, it's kind of normal that we are talking about this because they don't know this report. And this epidemic is already starting to occur. Now, WHO based its study on the preliminary dose estimation. It states the following is stated there. Well, the Japanese government lobbied WHO for revisions of this preliminary dose estimation. And so this has led to the reduction of 1/10 and 1/3 of the preliminary dose estimation, and that was the basic dose estimation that the WHO have had to adopt, according to an article by Asahi newspaper. And so in that sense, it seems like the breakout of thyroid cancer that we are currently seeing in Fukushima seems to be based more on the original preliminary WHO dose estimation rather than the revised one. This, by the way, is the epidemic curve of thyroid cancer in Chernobyl. Number of cases on the vertical axis and the year on the horizontal axis. This was when Chernobyl occurred, and this is Fukushima now, compared to the number of years after Chernobyl, so 4.5 years. You obviously see that there is a breakout, and we were not able to predict this. And what is happening is that the authorities in Japan are claiming that we are seeing in terms of the incidences of thyroid cancer have nothing to do with the Fukushima accident. But Fortunately, in Fukushima, we have already seen this level, much bigger than expected level of the incidence of thyroid cancer. In Chernobyl, the curve looked like this. So you can see that there is a gradual increase. And what would happen after that? Well, does that mean that we will see such a steep curve later on? Well, we already know that from Chernobyl, but nevertheless, no measures are currently taken by the Japanese authority. Now, going back to Aristotle's and persuasion, well, the first element of persuasion is logos, persuasion by proof. This is what Aristotle states. This is the essence and core of debate and convincing. So I have cited the book that I read on Japanese title. And I also quoted directly from Aristotle's rhetoric. And it states that this is the true essence and core of trying to convince the other of one's statement. But what is often mistaken is that it doesn't always mean that you can always persuade and convince the listener if you are right and if your statement is right. That's not really the case. That doesn't work that way. And so that's why two other elements or preconditions are important. First element is pathos. You need to move the others. You need to lead the others' emotions so that they will be more accepting of your own persuasion. And ethos is not very much known, but that's another precondition. Listeners' impression of the speaker. This is something that people naturally do. We believe good men more fully and more readily than others is what rhetoric says.
Sorry, my poor attire. And then if you use this approach opposite way, that is ad hominem. If you looked like a person who are really nicky-picky, that's not good for you. And these are three keywords, that is wisdom, virtue, and goodwill. I needed to cultivate wisdom, virtue, and goodwill, and I have made an all-out effort in the past 6 months. However, it's really hard for me to cultivate these three keywords. Anyway, Persuasion to Fukushima Prefecture, Ministry of Environment, and the Ministry of Economy, Trade, and Industry. Nothing worked because there's no logos, and therefore it's nothing we can do because there's no scientific rationale, and initial stereotype overrides the scientific rationale, and that's why there's no proving studies. In addition to that, no significant difference is mixed up with no onset of cancer. It's terrible, and researchers are the same. ICRP and Unscare is their basis. They say it, however, they don't explain where the exact basis exists. And what they actually do is totally opposite of ICRP recommendations. I base myself on the papers and data analysis, and I have close communication with international researchers to sophisticate my arguments, and there is no effective rebuff. There are many people who believe that it's TSUDA's ideas. However, I don't mention anything I myself came up with, actually. All of my arguments is based on papers or something. And then pathos, you have to move the emotions of the listeners. Of course, you should not rely on emotions too much because your counterpart is government officers. And because maybe your response is wrong, and therefore we invite critical opinions were invited. But this is a problem of ethos. Fukushima people are suffering, especially immediately after the accident. The way the government explained is wrong, and that's why they invited many criticism. By the way, in this part, I didn't make any efforts at all. I'm really lazy about pathos development. I was really shocked in the initial phase, and then I tried to do anything that I could do. However, the enthusiasm came down because partly I have many tasks I have to do. Now, ethos, business impression of a speaker. For example, the government exists to protect health and wealth of the residents, and that should be the ultimate purpose of the administration. However, it's not well communicated. In addition to that, the Fukushima mass media aligned with the mistakes made by the government of Japan, and then rather than the disclosure of information to Fukushima residents, the societies and the medical associations prioritized, and nobody pointed out any mistakes. And to me, my error would be the poor character, but then I'm going to make an all-out effort to cultivate wisdom, virtue, and goodwill. Just being in a different camp, maybe I'm regarded as the anti-establishment, anti-nuclear, or the leftist. However, I'm just talking about the arguments based on the science. This kind of polarized structure has been kept in Japan. So there is still the Cold War remained in Japan. So in this polarized world, we try to persuade the government. In addition to that, the government of Japan believes that they are rightist. Based on this background, every decision is made. So regardless of your attitude, regardless of the counterpart's idea and attitude, they are totally indifferent. I am regarded as the leftist bastard. However, their stereotype is that I don't want to be regarded that way, partly due to the psychology of the baby boomers. There is many psychological researches targeting the baby boomers. However, this kind of emotions and psychological work were not studied at all. Now, this is another example. This is one of the opposite opinions to me. The answer to how to deal with radioactive contamination in Fukushima is not as simple as evacuation. As I wrote yesterday, quite a few have died due to evacuation or suicides. Many deaths are related to decontamination work. It's meaningless to discuss only cancer rates or incident rates when it comes to the radiation disaster in Fukushima Prefecture. At a glance, it seems persuasive. And then you have to have figures for all of the arguments. You have to pick up the figures, and actually you may have already noticed that there's no number at all. Even the incident rate of cancer is not referred at all. There's no supporting numbers and figures. And they just say what they want to say, and that's all, period. And they never allow me to rebuff it. This must be what they mean. This opinion is out of question. That's why I am right. This is a stereotype they have. Now it is closed beyond this. They are just talking about outrageous points, and therefore I'm right. And there's no meaning of keep discussing. No room for rebuff. And this is a really typical Japanese attitude. That's why there has been no communication exchange, because our attitude is at this level, or at least the government attitude is at this level. Now, this is the situation, and then I try to let the international society know the Japanese situation, and I have written the long letter. So I have written a letter to encourage discussions, whether it be the ethical committee or the philosophy committee. And there is the response letter coming back, and there is the English version available. And there are many points included in this letter. For example, by referring Shotoku Taishi's remark, have a thorough discussion. referring to the Japanese ancient leader, indicating that I am one of the Japanese. However, to be frank with you, I don't know this remark made by the Shotoku Taishi. By the way, Shotoku Taishi said that when big things are at stake, the danger of error is great, and therefore many should discuss and clarify the matter together so the correct way may be found. Assistant professor of Harvard said this. Anyway, this dialogue is critically absent in regards to radiation health effect in current Japan. Why? We have to keep persuading the counterpart. Unfortunately, so-called radiation experts in Japan appear to have very little knowledge of radiation health effects or how those effects become elucidated specifically. At least medical doctors are so. Even worse for government officials and politicians are not involved directly in this kind of discussions. In addition to that, they are not others. You should not give up. For example, they are nuclear village folks. You should not ignore them. Rather, we have to raise our engagement level to get the involvement of them. Because of your capable ability, if you work sincerely, I can assure you, you can persuade the counterparts if there's an opportunity given to you. So now we are being tested how clever and smart we can persuade the government and related officials.
If there is just one question for clarification, because we're running a bit behind time now. Otherwise, we'll move to a more general discussion of all the papers, because we should really finish by 1:30 in order for people to have time for lunch and start again at 2:30, if I've got that correct, I think. So we have about 20-25 minutes. Is there a question for Professor Tsuda? No. Thank you. For more general questions to all of the speakers. This afternoon we will be discussing this issue of risks below 100 millisievert. Do we have any? You have yes.
I guess one of the background issues here is the scientific details on the whole are reasonably complicated, and the way to move the politicians is to get the community on side, but communicating with the public is often difficult because of the complexity, and that's why I think the process we're challenging ourselves with this afternoon is so important. Yeah.
Yes, I mean we have a solid opinion on this panel of scientists that the risk below 100 millisievert per unit dose is at least the same as the risk above 100 millisievert per unit dose. So there is no significance to this 100 millisieverts. And I understand that a number of organizations were approached to send a speaker to give the case for a threshold or a lower risk below 100 millisievert, and not one person accepted that challenge. But basically, when we are dealing with a scientific issue, we should be able to debate it, and those who hold different opinions should defend their opinions so that it can all be discussed and we can reach some kind of a consensus conclusion. So to actually refuse to take part in this debate is, I think, a very serious issue. I mean, I don't see how science can proceed if that is the situation. So, but that is for this afternoon. Do we have any questions for the panel? We do. Here, please. A microphone.
放射線被曝を学習する会の
I'm Tajima from the study group of radiation. My question goes to Dr. Matthews. Dr. Matthews, actually, the number of CT scan should be the basis for the analysis, and I heard your presentations really precious. My question is that why studies done by you, Dr. Matthews, has not existed in Japan? Why similar studies do not exist in Japan? The base data does not exist, or data exists, however, capable scientists and experts do not exist. Which is the case? Maybe I have to ask this question to the people in this room as well as the other experts. However, because you researched the CT scans, therefore, if you can answer to this question, I really appreciate it. What is the cause of the problem?
Thank you for the question. The reason we were able to do the study in Australia is that we had a universal government system which pays for healthcare of Australian citizens on a fee-for-service basis. So if someone had a CT scan, then the type of scan was recorded. And with 680,000 scans, obviously we couldn't do it by going around and collecting paper records. And we also needed to be able to access people who didn't have a CT scan. There are 11 million of those. And again, we couldn't do it without having a computerized, comprehensive system. And the third thing is that we had to find out who got cancer. And fortunately, Australia has registered all cases of cancer since about 1982. So we started our follow-up from 1985, and we used electronic linkage to link the exposure information and the demographic information to the cancer information. So if Japan had a computerized system of exposure information and a cancer registry, then you would be able to do the study in Japan. And I'm sure there are very many clever Japanese people who would like to do that, but my understanding is you don't have a cancer registry and you don't have a computerized comprehensive record of things like CT exposure.
I think there was another question there as well. I saw two hands, I think.
I would like, if it's an addition to the previous questions, and perhaps the moderator, I'll let the moderator, the editor decide, the chair decide, but maybe you could add it now. In Japan, the statisticians and epidemiologists are very rare species compared to the West. For example, epidemiologists specializing in the air pollution, there are just a few. There are perhaps maybe 5 people in Japan in total. And if I ask the same question to the U.S. Colleagues, saying how many are there in the U.S., well, we have never, he said, perhaps maybe there's 10,000 epidemiologists focusing only in air pollution. So really, the difference is incomparable. Majority of the people in the Department of Medicine in Japan think that statistics or epidemiology is not science. That is why they don't study that. So they are so certain that if they spend time learning about statistics or epidemiology, then they would not be able to advance their career as a scientist. This is really 100 years lagging compared to Western countries or the European or American countries. And really, this is exactly what I wrote about in the article that was published in the Iwanami's Science that was published lately. So please read about it. But anyway, most Japanese people, if you would ask Japanese people what is science, very few people can answer that question. Even the professors in universities would not be able to answer a direct question, what is science? That is why they tend to ignore me and try to not, because they don't like my straightforward answer. And does anyone in Japan talk about why people go to universities? What are we supposed to learn in universities? Well, no one even talk about these basic elements. And what people do in Japanese university is that people pay 2.5 million yen of tuition, a tremendous amount of money, and spend 4 years in university just to get a piece of paper. And if people would claim that that is the case, they can't counter that argument. And as for the professors who teach in the universities, their job is to sell this piece of paper called graduation diploma. Now, learning university, as I said, true meaning of university is a place where you learn how to rectify and modify the concepts. And that is what scientific study is all about, after all. But no one ever talks about that in Japan, in universities, and that is why Japanese university professors are so not good at debates and persuasions. That's why they remain silent. That is the fundamental problem of Japan. Regarding cancer registry, the Association of Medicines in Japan is currently preparing to put in place a cancer registry in Japan. Does anyone can anyone explain about that? Well, regarding the cancer registry, I believe the prefecture of Osaka is most advanced, and followed by Miyagi Prefecture. And other than that, we don't see much efforts in terms of cancer registry. Okayama Prefecture also tried to create such registry about 10 years ago, but didn't go so well. And to begin with, a lot of people are unsure about the purpose of cancer registry. So that is why they are not motivated, and that's why they cannot get the budget. So if they were to count the number of deaths, that means the great purpose of that is to understand the reasons, the causes of death or causes of illness. But because they don't have this idea of understanding of this overarching objective, they are not motivated to participate.
今の論点の関係の
So I would like you to stick to the same discussion point that has been already raised. Do you have a related question, Aihara-san? Well, I just would like to add to what you were saying. I fully agree with Professor TSUDA. Regarding cancer registry, the basic act on the cancer registry has just been enacted 2 years ago in Japan, so it's just beginning now. So of course we cannot expect the same kind of data as in Australia. Of course we are the most irradiated population around the world, but we don't have such data. So we really cannot recreate the same kind of study as has been done in Australia. That is the current situation. But more than that, as Tsuda-san rightly said, people don't understand the purpose of cancer registry. The one excuse of not creating cancer registry is because in Japan it was almost impossible to declare that a patient has a cancer. So in that situation, the cancer registry creation would be problematic because that individual patient can access the registry, but that's just an excuse. Utilize the same data? Well, there was no clear purpose of what to do with that data. We now, as I said, have the basic act on cancer registry, but now I think we are in a very risky situation if we were to create cancer registry in today's Japan. I believe that in case of children, in case of pediatric cancer, this is cancer occurring among children. So this is a very early stage of diagnosis. So in that sense, maybe we can clarify the relationship between the cancer and its causes. So that is prioritizing children and pediatric cancer. But we are not even prioritizing pediatric cancer as the first step of cancer registry. So we don't even have an agreement on prioritization. And yet there's another element, which is the protection of individual or personal information. So in that sense, the ethical issue are not clarified, and there is no clarification as to what kind of personal information can be released. So creating a cancer registry in today's Japan can create a havoc because it can really lead to leakage of more personal information. And what is closest, in a way, is the efforts at FMS, the FMU, for the Fukushima the health management survey, and that need to be utilized in the cancer registry. But unless that is possible, I think it's meaningless. Regarding a cancer registry, from the perspective of the patient, about 20 years ago from now, there was another initiative back then of creating a cancer registry in Japan. And the reason, because at that time, people didn't know where patients were in Japan. So there was a concentration of medical services in only certain area. CT scans and other instruments were all concentrated in particular area, geographical area in Japan. The doctors and experts were only in certain areas in Japan back then, 20 years ago. So by creating a registry, let us understand more where patients are and let us contribute to epidemiological data. That was the effort 20 years ago. But unfortunately, the collaboration didn't work so well. And that data should have been started as a data for the sake of the patients, but that initial purpose has been forgotten. What's happening now, 20 years later, is creating a commodity of utilizing and commercializing patients' data. That's what we're seeing much more. So are we really thinking about the interests of the patients? That's not really the case. And current discussion about cancer registry is really tragic because we're not even thinking about the interests of the patients. I talked about the cancer registry being prepared by the medical association. Well, that was not really the case. Sorry for my confusion. It was the current association's proposal is it's creating a medical depot. And we have Kasuga-san and Sebastian who would like to comment or question, right?
So listening to your questions or comments, I wasn't sure what to say and what to make a comment. I'm getting more confused now. So this morning I was late for this meeting. I was sorry about that. Listening to the first speaker, Mr. Musso, I just realized how much I don't know. So seeing this latest research presented today at the meeting, so the question is why that the official arena organized by the government, as Mr. Tsuda mentioned earlier, I don't know why the discussion can't be held. So I'd like to have as many people as possible to understand what's going on through this type of event. Well, there are various data in different sectors or by different institutions, or even in Japan, in Fukushima, there is a biological research done. There are some researchers who are engaged in that data, but the information hasn't really been shared with other people. And the similar research have been done overseas, but it's difficult for us to access such external data. So that's something we have to reflect upon in terms of the structure of the scientific information sharing. In Mr. Tsuda's presentation, he made a recommendation and also criticism on the way the scientific community works here in Japan. And there are different researchers in the biological area and other sciences who have to work together from different fields of science. In relation to nuclear accidents, we have exhausted different discussions in the subcommittees. So getting information from different institutions, different researchers, the question is how we can share such information in a more usable manner. So that's been something I have been suggesting from 2012, but this hasn't been really incorporated in the policy making process. That's something we have to do more follow-up to make it happen. For example, CT scan data. Well, partially, it's related to disclosure of receipt information, medical information. Well, that's been more of the case. Medical claim information. So like in Australia, different researchers, scientists have done analysis based on their interest. Well, I don't think that's the case in Japan, but in the direction we'd like to aim for, we'd like to share the information, and we understand that more and more people are aware of the importance of sharing such information. Well, as Dr. Tsuda mentioned, well, most of what is said is something that I can agree to. But in the area I have directly involved in, well, I can't sometimes I cannot agree with what I said, like the data from Fukushima. The Fukushima Prefectural Hospital presented the information for the academic circles rather than the general public. In the latest meetings I attended, the Fukushima Prefecture presented the data, and they said that they set up a committee to discuss how they should disclose university-generated information. Well, it's not that no one complains about the way the information has been distributed from the Fukushima Prefecture. For the return of the people, we have to ensure the safety and security in that area. Some of the reports has been dealt rather lightly. So as a committee member, I feel really mad at that, and just focus on the return of people to where they used to live. For any options they have selected, we have to respect their choices they have made. So that's been reflected in NAR. So NRA, sorry. Well, the threshold of 20 millisievert a year, we didn't say that it's safe to live continuously in an environment where there's always a constant 20 millisieverts a year. So that's something we have to sort of dispel the confusion. The reason why it's difficult for researchers with different ideas to have a discussion in the same arena, I'm going to make a presentations later, but if we change the setting of venue, I don't think that's not impossible. It's quite possible, actually. So the question is why we can't do that. Well, we have to reflect upon the way we behave so that we can get together at the same venue. After the earthquake, all the people involved would like to improve the situation for Fukushima and also help the lives of Fukushima people. So they have a faith in what they say in their respective specialty. But there is the reason why those comments are not accepted as they are. So there's a bipolar of opposing ideas. There are pro-nuclear versus not. There are other people who are opposing the idea of having a nuclear plant. And also, we haven't done much thinking about what was the root cause of this incident, first of all. So there was a situation we had earlier we can't ignore. We have to think about why the other party is not willing to meet us at the same venue. We have to think about their sort of approach to the situation. Well, of course, it's important to clarify the difference between different ideas. We also have to look at where is the common background of footing we can utilize to have a common discussion. Well, that's something I'd like to discuss this afternoon. Well, I don't know if I can communicate myself well enough to make you understand, but that's the impression that I had through the morning sessions.
Question from Sebastian, and then we should go to lunch.
Ich möchte noch erinnern an die Diskussion, die wir bei den letzten Kongressen hatten über die Frage der
to record a disease in the registration. Well, as for that issue, there was some discussion made at the previous meetings. For example, in Germany, after the Chernobyl incident, there's a deformation among the children. That's something we have seen increasingly. Once researchers start talking about this, would they stop counting the number of deformed children? They stop the registration of such children. Rather than cancer issues, deformation happens earlier than cancers. So understand the number of deformation among children is more important. But in Germany, the number will become significant. As soon as that's been known, then people stop counting the number of deformation among children.
Teratogenicity is a more significant issue.
Des Zugangs wichtige Fragen gar nicht bearbeiten kann. Und das Argument ist in der Regel Datenschutz.
So in Germany, to protect the human rights, to protect individual information, it's difficult to access such personal data. Even researchers would like to access such data. That's not always the case. It's very difficult to access such information. So about the presentation done by Dr. Matthew, thank you very much. Any question? So about your research for the radioactive protection, what radiation protection? So what kind of method do you think you can generate, you can think about based on your research for the radiation protection? What can you suggest as a radiation protection?
As CT scans are concerned, the communication with the public in Australia has been supported by our government. They've spoken to the radiologists, they've spoken to the radiation safety people in Australia, and they put out a consensus statement which emphasises that every CT scan should be fully justified on clinical grounds before it's done, and people are advised not just to do a CT scan in a child to avoid the risk of malpractice suit later. It's got to be justified on clinical grounds, and obviously the advice is to reduce the dose of each procedure to the minimum necessary to produce a diagnostic image. Now that message has gone out. In Australia, the radiological community have been quite receptive. In North America, however, there are a number of groups of radiologists and people associated with the nuclear industry who refuse to believe there is a risk from CT scans. So that's the public dimension, and I think getting the public on side by increased communication will help to convince the radiologists and the doctors who order CT scans that they've got to be more careful, and it will also put continued pressure on government. Now, the other thing, of course, is it's not impossible that someone might eventually be able to invent an antioxidant treatment or something prior to a CT that can be shown in animal studies to reduce the risk, but I think that's quite a long time away. So I think the question of data access and the question of responding to risks that are emerging, they're linked, because the public needs to be on side, on the one hand, to tell the politicians and the lawyers that we need cancer registries, we need data access to protect the population against not only radiation risks, but other pollution risks. I mean, Japan's done very well in recent years in responding to other environmental pollution risks, but it hasn't quite got up to the 8 ball in the radiation area. So I think mobilising the public is the best response, because if scientists have to explain what they're doing in simple terms to the public, it makes them honest, and if the public understands, then they can pressure government, and no single doctor would ever have worked out the effects of low-dose radiation just by looking at his patients, because the risks are far too small. And so it's a public sector response that's needed, and in a sense that's political, because the public health response that is a collective response is, you know, sometimes associated with the left wing, but it's really common sense. I mean, if the world's going to maintain itself, we've all got to work together. And I think there's a strong history of that in Japan, but not just particularly in this area, unfortunately.
Okay, thank you. And I would like now to thank all the speakers for their contributions today. I think they've stimulated a lot of interesting discussion which will take place this afternoon, and we will reconvene in 1 hour, so that will be 2:40. So thank you again, and I look forward to a very good discussion this afternoon.